Hi, my name is Kiran Sandhu, and today I will be doing a presentation on trauma informed, recovery oriented care in Indigenous Australians. Before I begin this presentation, I would like to acknowledge the traditional custodians of this land, and I pay respects to the elders past, present, and emerging. The main contents of this presentation are introduction, background, recommendation, assessment of recommendations, conclusion, and finally the reference list. I will be giving a brief introduction about trauma, intergenerational trauma, and trauma-informed care in Indigenous Australians. In the background, I will discuss the barriers to implementing trauma-informed care, drawn from Assessment 2. In the recommendations part, we will be looking at detailed recommendations to support trauma-informed, recovery-oriented care. In the assessment, we will look at why these recommended practices are needed and how they improve the recovery-oriented practices. In conclusion, I will be summarizing the key aspects of this presentation. The last two slides contain the reference list. So let's begin. Trauma is defined as a physical or psychological reaction to an event, series of events or circumstances that an individual experiences as physically or emotionally harmful or threatening, with lasting adverse effects on individuals' physical, social, and mental well-being. The colonization and oppression of the Aboriginal and Torres Strait Islander people has led to intergenerational trauma. And Indigenous people are more likely to experience symptoms of early trauma, such as post-traumatic stress disorder, including hypervigilance, anxiety, and mood dysfunction. Trauma-informed care is a strength-based approach to caring for individuals mindfully, with compassion and clarity regarding boundaries and expectations. Levenson in 2017 proposes that trauma-informed care in social work settings should incorporate core principles of safety, trust, collaboration, choice, and empowerment. We will now talk about barriers to trauma-informed recovery-oriented care. The Department of Health, in their 2018 report into the accessibility and quality of mental health services in rural and remote Australia, have listed the following barriers: poor access to health services, social and geographical isolation, funding restrictions, cost of traveling to mental health services, and stigma around mental health services. Other barriers listed by various resources include the following: lack of culturally safe services, lack of local knowledge, awareness, and engagement, actual and perceived discrimination, lack of social acknowledgement of the survivors, lack of expertise in trauma-informed care, avoidance of the trauma population due to shame and fear, and complex administrative processes. Kazlowskis in 2017 noted that the recent findings in the traumatic stress research field have identified several major barriers for dissemination and delivery of effective PTSD treatments of traumatized populations. These barriers include lack of acknowledgement of survivors, avoidance in trauma disclosure, and limited resources. Across various cultures, trauma survivors may experience stigmatization and a lack of acknowledgement. Several studies have demonstrated the negative role of social acknowledgement, which in turn results in inadequate healthcare policies on a national level. And Nolan, Isles et al. Noted that the cultural competency of non-Aboriginal staff is also an important factor. The Victorian Auditor General's report in 2014 outlines the main barriers are actual and perceived discrimination by service providers, language and cultural barriers, lack of trust in services and organization, and a lack of awareness and engagement with local Aboriginal communities. I will now be discussing some recommendations to support trauma-informed, recovery-oriented care. The first recommendation involves changes in organizational culture. The Substance Abuse and Mental Health Services in 2014 report recommends that trauma-informed approach requires having a basic realization by all people at all levels of organization. Nursing literature on trauma-informed care recommends trauma screening and patient disclosure, minimizing distress and maximizing autonomy, multidisciplinary collaboration, and referrals in diverse settings. And there is growing evidence that connection to culture, in parallel with promoting cultural continuity, needs to be incorporated in the designing and operation of complex interventions into the Indigenous people's mental health and the promotion of their social and emotional well-being. The next recommendation is in context of policy changes. Several studies have noted that misguided policies and service delivery practices are leading to further systemic racism. And in order to be culturally safe in our trauma-informed practice, we have to incorporate an understanding of trauma into our cultural safety training. They also propose that an understanding of the Indigenous model of health is essential to avoid re-traumatization in this population. The Indigenous model of health involves connection to country, spirit, spirituality, ancestors, culture, community, family, kinship, the physical body, mind, and emotions. The Victorian Auditor General's Office recommends policies supporting the Aboriginal community-controlled organizations for empowerment of Aboriginal communities and having culturally supportive plans. They also recommended effective monitoring, reporting, and evaluation frameworks to improve service access. The next recommendation is in context of professional practice. Grossman et al. Recommended that trauma-informed, recovery-oriented care in professional practice can be attained through formal teaching and training of the staff, mentoring, and establishing trauma-informed organizational structures. They also recommend multidisciplinary collaboration, referrals in diverse settings, and developing appropriate trauma-informed knowledge and expertise. McCallum noted that there is historical evidence that recommends that problems of intergenerational trauma among Indigenous populations should be handled not by mental health practitioners or non-Indigenous experts, but rather by Indigenous communities themselves, with assistance only if required. The Healing Foundation in the Strategic Plan 2023-2028 have given a targeted, outcome-focused and survivor-centered approach that guarantees that stolen generation survivors' voices remain leaders of their healing journey. So why are these recommendations needed? Menzies noted that collective intergenerational trauma is strongly evident in Australian Aboriginal communities, and it is important that practitioners in child protection, health, and social welfare practice should be trauma-informed. The 2014 Victorian Auditor General's report outlines several barriers to trauma-informed care and gave recommendations to improve the services to Indigenous people. It is very important to close the gap between Indigenous and non-Indigenous people, as statistics show them disproportionately overrepresented in correctional facilities and having poorer health outcomes. How will these recommendations improve the outcomes? These recommendations will help improve recovery-oriented practice by bringing organizational commitment to culturally safe, culturally competent care. that empowers Aboriginal communities by involving them in decision making for their own recovery. These recommendations will ensure policy changes that ensure organizations have a sound understanding of the service needs, develop and implement effective plans, programs, and strategies to facilitate access to services for Aboriginal Australians. The policy changes will also ensure adequate funding is provided for training, expertise, and resources that are needed for trauma-informed practices. In conclusion, intergenerational trauma is still strongly evident in Aboriginal Australians. It has led to many behavioral responses linked to poor health outcomes. Trauma-informed, recovery-oriented care is crucial to healing, and recommendations include commitment to trauma-informed organizational structures, policies empowering Aboriginal communities to follow Indigenous model of health and professional practices, training staff in culturally safe trauma-informed practices. These recommendations are needed to make sure every effort is made to close the gap and ensure that survivors remain leaders of their healing journey. Thank you.